AIDS, or acquired immunodeficiency syndrome, is a life-threatening condition that develops as a result of the human immunodeficiency virus, or HIV, attacking and gradually destroying the body's immune system. The immune system is our natural defense against infections and diseases, and when it becomes severely weakened, the body is left vulnerable to a wide range of illnesses that a healthy immune system would normally be able to fight off with ease. This breakdown of the immune system makes it extremely difficult for the body to fight off even common infections, which can become much more serious and even life-threatening for someone with AIDS. Everyday germs, bacteria, and fungi that are usually harmless can cause severe health problems. One of the most noticeable and early visible signs of a weakened immune system in people living with AIDS is the development of oral thrush. Oral thrush is a type of yeast infection that appears as white or yellowish patches inside the mouth, often on the tongue, inner cheeks, or roof of the mouth. This fungal infection is caused by a type of fungus called Candida, which is normally present in small amounts in the mouth. However, when the immune system is compromised, Candida can grow out of control, leading to the uncomfortable and sometimes painful symptoms of oral thrush. Understanding the connection between AIDS and oral thrush is crucial for both patients and healthcare providers. Recognizing oral thrush as a potential warning sign of immune system decline can lead to earlier diagnosis of HIV or AIDS, and prompt treatment can help prevent further complications. Oral thrush is a common and recurring problem for people with AIDS, especially as the immune system becomes more compromised. It can cause discomfort, difficulty eating or swallowing, and may even affect a person's ability to speak clearly. The good news is that oral thrush is treatable. There are effective antifungal medications available that can clear up the infection, and with proper medical care, most people experience relief from symptoms within a few days. With consistent treatment, good oral hygiene, and regular checkups, the discomfort caused by oral thrush can be managed, and further outbreaks can often be prevented. It's important for people with AIDS to work closely with their healthcare team to monitor their oral health and address any symptoms early. In the following sections, we'll take a closer look at how AIDS affects the body, why oral thrush is so common in people with weakened immune systems, and what steps can be taken to protect oral health. We'll explore the causes, symptoms, and treatment options for both AIDS and oral thrush, providing you with the knowledge you need to recognize, manage, and prevent these conditions. AIDS is caused by the human immunodeficiency virus, or HIV. This virus attacks the body's immune cells, which are the body's defense system against infections. As HIV weakens the immune system, the body becomes vulnerable to a range of opportunistic infections. These infections are called opportunistic because they take advantage of the weakened immune system. They wouldn't normally cause illness in a healthy person. AIDS is the most advanced stage of HIV infection. When someone has AIDS, their immune system is severely compromised. This makes them highly susceptible to infections and illnesses that a healthy immune system would normally fight off with ease. Oral thrush, also known as oral candidiasis, is a fungal infection that occurs in the mouth. It is caused by an overgrowth of a type of fungus called Candida albicans. This fungus is normally present in small amounts in the mouth. However, when the immune system is weakened, Candida albicans can multiply rapidly. This overgrowth leads to the development of oral thrush. This is why people with AIDS are more susceptible to this infection. Oral thrush is characterized by creamy white lesions that appear on the tongue, inner cheeks, and sometimes on the roof of the mouth, gums, and tonsils. These lesions can be uncomfortable and may cause pain or difficulty swallowing. The link between AIDS and oral thrush lies in the weakened immune system. As HIV progresses to AIDS, the immune system becomes severely compromised. This makes it difficult for the body to control the growth of Candida albicans in the mouth. As a result, people with AIDS are more likely to develop oral thrush. In fact, oral thrush is often one of the first signs of a weakened immune system in people with HIV. It is important to note that not everyone with oral thrush has AIDS. However, if you have oral thrush, it is essential to get tested for HIV to rule out any underlying health conditions. Recognizing the symptoms of oral thrush is crucial for early diagnosis and effective treatment. Oral thrush, also known as oral candidiasis, is a fungal infection that can affect anyone, but it's especially common in infants, older adults, and people with weakened immune systems. Being able to spot the signs early can make a significant difference in how quickly you recover and how easily the infection is managed. The most common and noticeable symptom is the appearance of creamy white lesions or patches inside the mouth. These patches often develop on the inner cheeks, but they can also be found on the tongue, the roof of the mouth, gums, and even the tonsils. These lesions may look a lot like cottage cheese, thick, white, and sometimes slightly raised. They can vary in size and may merge together to form larger patches. In some cases, the tissue underneath these white patches can appear red and raw, especially if the lesions are scraped or rubbed. Other symptoms of oral thrush include redness, soreness, or a burning sensation in the mouth. This discomfort can make it difficult to eat, drink, or even speak comfortably. Some people may notice cracks or redness at the corners of the mouth, which is another sign of the infection. In addition to visible lesions and soreness, you might experience a loss of taste or an unpleasant, cottony feeling in your mouth. Swallowing can become painful, and in more severe cases the infection may spread to the throat, making it even harder to eat or drink. Some people also report a dry mouth or increased sensitivity to spicy or acidic foods. In severe cases, the lesions may bleed slightly when scraped, and the affected areas can become very tender. If left untreated, oral thrush can sometimes spread to other parts of the body, especially in people with weakened immune systems, leading to more serious health issues. If you notice any of these symptoms, whether it's white patches, soreness, difficulty swallowing, or changes in taste, it's important to consult your doctor or dentist as soon as possible. They can examine your mouth, confirm the diagnosis, and recommend the best course of treatment. Early treatment is key to preventing the infection from spreading and reducing the risk of complications. With prompt care, most cases of oral thrush can be managed effectively, helping you return to comfort and good oral health quickly. Diagnosing oral thrush is usually pretty straightforward, but it's important to understand exactly what your healthcare provider is looking for. Oral thrush, also known as oral candidiasis, is a fungal infection caused by the overgrowth of Candida species, most commonly Candida albicans. This condition often presents as creamy white lesions on the tongue, inner cheeks, roof of the mouth, gums, or tonsils. These patches can sometimes be painful or cause a burning sensation, and in some cases they may bleed slightly if scraped. Your doctor or dentist can often make a diagnosis simply by visually inspecting these characteristic lesions in your mouth. They'll look for the telltale white patches and may gently try to wipe them away to see if the underlying tissue is red or inflamed, which is another sign of thrush. Sometimes, especially if the diagnosis isn't clear or if the infection is persistent, your healthcare provider may take a small scraping of the lesion. This sample is then examined under a microscope to confirm the presence of Candida albicans or other types of yeast. In rare cases, further tests might be needed to rule out underlying conditions that could be contributing to the infection, such as diabetes or immune system disorders. Now, when it comes to treatment, oral thrush is typically managed with antifungal medications. These medications are designed to target and eliminate the Candida fungus, helping to clear up the infection and relieve symptoms. Your doctor will choose the most appropriate medication based on your age, overall health, and the severity of your symptoms. Antifungal medications come in several forms, including medicated mouthwashes that you swish around your mouth and then spit out. These are often prescribed for mild to moderate cases and are easy to use at home. Other options include antifungal lozenges that dissolve slowly in your mouth, as well as pills or tablets that you swallow. Pills are usually reserved for more severe or stubborn cases, or if the infection has spread beyond the mouth. Your doctor will determine the best course of treatment based on just how severe your infection is, your medical history, and whether you have any risk factors that might make thrush more likely to recur. It's important to follow their instructions carefully and complete the full course of medication, even if your symptoms start to improve before you're finished. In addition to antifungal medications, maintaining good oral hygiene is absolutely essential for both treating and preventing oral thrush. This means keeping your mouth as clean as possible to reduce the amount of fungus and bacteria present. You should brush your teeth at least twice a day using a soft bristled toothbrush, and floss daily to remove food particles and plaque from between your teeth. Replacing your toothbrush regularly, especially after an infection, can also help prevent reinfection. Rinsing your mouth with an antifungal mouthwash, as directed by your doctor, can further help to clear the infection and keep your mouth healthy. Avoiding mouthwashes that contain alcohol is also recommended. as they can cause irritation. By combining proper medical treatment with excellent oral care, you can effectively manage and prevent oral thrush. Preventing oral thrush in people with HIV is, honestly, crucial for maintaining good oral health and overall well-being. The most important step in prevention is to take antiretroviral therapy, or RT, as prescribed by your doctor. ART is a type of medication that helps control HIV infection. It works by reducing the amount of HIV in your body, which helps strengthen your immune system and reduce your risk of opportunistic infections like oral thrush. In addition to ART, other preventive measures include practicing good oral hygiene, avoiding tobacco use, and limiting alcohol consumption. It's also important to see your doctor regularly for checkups and to discuss any concerns you may have about oral thrush. Early detection and treatment of oral thrush are really crucial for preventing complications and improving outcomes. When left untreated, oral thrush can spread to other parts of the body, such as the esophagus, lungs, and even the bloodstream. This can lead to serious health problems, especially in people with weakened immune systems. Early treatment with antifungal medications can effectively clear the infection and prevent it from spreading. If you are experiencing any symptoms of oral thrush, don't hesitate to seek medical attention. Early diagnosis and treatment can make a significant difference in your recovery and long-term health. Oral thrush, while a common and treatable condition, serves as a reminder of the importance of maintaining a healthy immune system. For people with HIV, oral thrush can be an early warning sign of a weakened immune system. It really highlights the importance of adhering to ART and taking steps to prevent opportunistic infections. By understanding the connection between AIDS and oral thrush, we can work towards earlier diagnosis, more effective treatment, and ultimately, better health outcomes for everyone. Remember, knowledge is power. By staying informed about AIDS, oral thrush, and the link between them, we can empower ourselves and others to take control of our health.